Solicito a las delegaciones tomar sus asientos.
I should like to ask the delegates to take their seats, please.
Already. El foro escuchará a continuación.
We will now hear the Voluntary National Review by Eritrea. I now invite Her Excellency Sophia Tesfamariam, Permanent Representative of Eritrea to the United Nations, to make a presentation. Distinguished Ambassador, Your Excellency, you have the floor.
Mr. President.
Solicito a las delegaciones por.
I would ask delegations, please.
Thank you, Mr. President. Good afternoon, Excellencies, ladies and gentlemen. It gives me great pleasure to present Eritrea's first voluntary national review report to the 2022 UN High-Level Political Forum on Sustainable Development under the auspices of the United Nations Economic and Social Council. Spearheaded by the Ministry of Finance and National Development, the VNR preparation process used a whole-of-government approach, which was highly participatory and robust. The process was locally owned, highly collaborative, and transparent, involving the contributions and participation of a range of entities, including ministries, civil society, and other organizations, and the UN development system in Eritrea. Focusing on Sdg Iii, health and well-being, and Sdg 13, climate action, and briefly touching upon the status of implementation of the other SDGs, the report represents Eritrea's unique experiences, including successes, lessons learned, and key takeaways in implementation of the 2030 Agenda for Sustainable Development. Eritrea's achievements on the two SDGs are impressive and offer important insights for other countries operating in resource-constrained environments. The report also reflects on challenges on Eritrea's development trajectory towards attainment of the priorities in its national charter and attainment of the SDGs. In Eritrea, sustainable development in all of its fundamental elements and principles remains an integral part of the country's long-term vision and policy architecture. The national policies and action plans are closely aligned with the SDGs. The charter adopted in 1994, for example, laid out the vision and aspirations for the country, summarizing them into a number of basic goals: national harmony, political democracy, social and economic development, social justice, cultural revival, and regional and international cooperation. Guided by the principles of self-reliance, Eritrea's development and nation-building processes are grounded on social justice and leaving no one behind. Unwavering emphasis is placed on ensuring that all citizens, regardless of their religion, language, locations, etc., can freely and fully participate in, contribute to, and benefit from the progress in national development programs. National policies, legal instruments, and social protection programs establish a foundation for development while guaranteeing and promoting a range of fundamental rights, including addressing the specific needs of vulnerable groups in the population. Eritrea is one of a few countries that entered the SDG period having achieved most of the health-related MDGs. The country's experiences and noteworthy achievements during the MDGs era have offered useful lessons and valuable insights, as well as provided a firm platform to build on successes and drive forward with added momentum for the SDGs. With regard to Sdg Iii, which aims for good health and well-being, and Eritrea's national health policies and health sector strategic development plans aspire to maximize the health and well-being of all citizens at all ages and seeks to ensure equity and access to essential health services consistent with universal health coverage. Since the launch of the SDGs in 2016, a wide set of interventions have been implemented to expand access and improve health care for all, leading to the achievement of UHC. Health service continues to be heavily subsidized, with patients required to make only nominal payments, which are wholly waived in case of financial need. Many essential health services are provided completely free of charge, while all patients with selected chronic diseases and other disorders are provided with free care and prescribed medications. Significant improvement was made in expanding health infrastructure through a construction and renovation of many health facilities, human resource development, and provision of essential medicines and medical equipment. Accordingly, the following achievements have been made in relation to Sdg Iii. Life expectancy at birth has shown significant improvement, rising from 49.6 in 1990 to 65.1 in 2016, and then 67.1 years in 2021. Currently, approximately 80 and 70% of the population lives within 10 and 5-kilometer radius of a health facility, respectively, representing major improvements within just a few decades. The maternal mortality ratio dropped from 998 per 100,000 live births in 1990 to 228 in 2015 and 184 in 2019, an overall reduction of 82% during the period from 1990 to 2019. The proportion of deliveries by skilled health workers has risen to 71% from 36% in 2010 and only 6% in 1990. Under 5 mortality rates was reduced by 75%, from 153 in 1990 to 39 in 2020. Tremendous strides have been made with regard to national vaccination. The proportion of the target population covered by all vaccines included in the National Immunization Program is nearly universal, with more than 95% of children fully immunized for their age. HIV prevalence and new infection rates have been reduced, with current prevalence among the general population of 0.6%. The country is transitioning from pre-elimination towards elimination of malaria. Regarding progress on Sdg 13, which advocates about climate action, Eritrea has signed and ratified a number of international climate change agreements and instruments. The Ministry of Land, Water and Environment, working closely with other ministries, offices, CSOs, and UN Development System, has prepared and submitted a range of climate change and biodiversity-related reporting documents. In order to achieve a climate-resistant, resilient future, Eritrea is working towards the development of renewable energy and efficiency improvement in all sectors, particularly in energy production, transmission, distribution, and consumption, as well as in transport, manufacturing, and household energy consumption. A number of projects are also in place to conserve, restore, and enhance natural areas, including regular nationwide afforestation campaigns involving the participation of communities, students, and youth groups, as well as water and soil conservation programs. Moreover, the climate change adaptation and mitigation measures include expansion of irrigation schemes and construction of terraces, dams, and ponds. Households and communities, especially those in high-risk areas, receive support and adaptation strategies and technologies, helping to reduce vulnerability, strengthen resiliency, and secure livelihood. Eritrea is vulnerable to a number of natural hazards, such as recurrent droughts, flooding, and storms, high winds, especially in coastal areas, locust swarms, and volcanic activity. National responses to and management of hazards and disasters involve a comprehensive approach. The Ministry of Land, Water and Environment, along with different levels of government and administration and various other partners, work collaboratively to mobilize resources, coordinate activities, and assist communities to recover. Regarding progress on other SDGs, there have been laudable improvement in provision of quality education, advancing gender equality through empowerment of women and girls, developing infrastructure, expanding the national roads network, raising agricultural production and productivity, and ensuring food and nutrition security, while access to electricity, water, sanitation, and hygiene, among other critical services, have been expanded, with notable expansions in rural areas. In the area of partnership and cooperation, Eritrea has established a cooperative framework and cultivated close partnerships with a range of bilateral and multilateral partners, regional and international organizations, and other entities. Meaningful engagement and effective cooperation are built, with concerted effort being based on complementarity and guided by the country's locally defined priorities and specific needs. In an effort to contain the spread of COVID-19 and mitigating its impact on socio-economic development, as well as implementation of the SDGs, the government of Eritrea took sustained, strong, and aggressive actions. This was supported in frequent and clear communications from authorities, high levels of public buy-in in solidarity, and past experience and success in controlling endemic and communicable diseases. Accordingly, Eritrea has maintained among the lowest death and infection rates in Africa, with a high recovery rate and a minimal community transmission. The total number of confirmed cases to date is 9,827, with 9,700 recoveries and 103 total deaths. While much overall progress has been made, the VNR process has identified areas of needs that needs improvement to enhance further progress towards the implementation of the SDGs in the remaining period of the agenda. The process has highlighted the need for strengthening the national statistical system and enhancing the provision of timely, quality, complete and disaggregated data to properly monitor and report on the progress of the SDGs. Moreover, there is a need to expend resources, foster cooperation, and cultivate partnerships to support a sustainable recovery from the COVID-19, fully realize developmental aspirations, improve the well-being of the population, and ensure the implementation of the 2030 agenda. I thank you. Video.
Achieving independence in 1991, after one of the longest liberation struggles in history, Eritrea emerged resilient and ready to realize a bold vision of achieving social justice, prosperity, peace, and unity for all. Eritrea's 9 ethno-linguistic groups live in 6 regions across over 124,000 square kilometers and 350 islands. Sustainable development in every form is an elemental part of Eritrea's long-term vision.
It's an attitudinal question. It's an approach where priority is given to the exploitation and the maximum utilization of one's own resources. That will guarantee ownership of programs, that will guarantee sustainability, that will guarantee optimal use of the country's potential.
Despite its young existence, its location in a region characterized by conflict and instability, and its subjugation to illegal and unjust sanctions, Eritrea has made progress. Eritrea has enacted a national health policy of nearly universal health care.
Currently, up to 70% of the Eritrean population lives within 5 kilometers of a health center. This represents a 4-fold increase in the number of health facilities since independence in 1991. A health system in Eritrea is highly subsidized by the government, including preventive care, and this is the reason behind the success in the different healthcare indicators in the country. So there has been a marked reduction in maternal mortality by 82%, neonatal mortality by 49%, and mortality of children below 5 years of age by 75%, and this is one of the fastest rates in the world.
More than 95% of children are fully immunized for their age. HIV spread has nearly stopped, and chronic diseases such as hypertension, diabetes, and mental disorders are mitigated through free care and medication. Additionally, significant investments have increased nationwide access to clean water to approximately 85%, up from 13% in 1991, and to enormous improvements in community sanitation. Eritrea is especially vulnerable to the adverse impacts of climate change. It is committed to expanding the use of renewable energy, improving energy efficiency, and conserving, restoring, and greening natural spaces.
Eritrea has developed a comprehensive multi-sector approach to address vulnerabilities to recurrent drought, expansion of desertification, biodiversity loss, sandstorm, locust swarm, etc.
Eritreans understand education as a fundamental human right, and the country has made immense inroads in expanding equitable access to quality education at all levels. Eritrea has achieved one of the largest increases in youth literacy anywhere in the world in the past 50 years. Future targets include continuing to expand access to electricity and broadening the road network. And 85% of cities and villages nationwide are connected by roads. Additionally, Eritrea works to empower women and girls through the propagation of progressive measures, aiming to increase the representation of women in all areas. At present, women make up nearly 50% of Eritrea's workforce.
Eritrea has made tremendous progress. If you think about coming from the Millennium Development Goal era, and particularly the MDG on health, Eritrea's progress then was remarkable. We now have a Sustainable Development Goal number 3 on health and well-being, and there progress has been significant. Another SDG that I am excited about is Sdg 13. This one is on climate action. And once again, impressive progress is being made, particularly on soil and water conservation efforts.
Eritrea remains committed to enhance sustainable management of its natural resources, addressing the impacts of climate change, achieving full universal health coverage, and improving the population's well-being.
I should like to thank the distinguished permanent representative of Eritrea to the United Nations and her team for this presentation. We shall now hear comments and questions from states and other participants. Delegations and participants who wish to intervene are invited to press the microphone button on the console. I would like to remind delegations kindly to limit their statements to 2 minutes each. I shall now give the floor to the distinguished representative of South Africa.
Micrófono para Sudáfrica, por favor.
Microphone for South Africa, please.
President, and we would also like to take this opportunity to thank the permanent representative of Eritrea as well as her delegation for this very comprehensive and impressive presentation on how they are doing with the implementation of the SDGs. The ambassador has presented both the amazing successes in a number of the SDGs, but also highlighted some of the challenges and the vulnerabilities that her country is facing on the 17 goals. We also note that the impact of the COVID pandemic in Eritrea is, of course, similar to what we have also experienced in our own country and in other countries. But nevertheless, we also are quite impressed at what Eritrea has achieved also in this area. Amongst others, from your VNR, you show us that Eritrea has maintained amongst the lowest death and infection rates in the continent of Africa, also with a high recovery rate and minimal community transmission. And of course, we congratulate you for this and we wish you success in the further work that you are doing towards the implementation of all the SDGs. I only have one question because when I was looking at your VNR, I noticed that you are only focusing on 2 of the SDGs, Sdg Iii and Sdg 13. I've also noted from the video that the UN resident coordinator also referred to these 2 SDGs. So if you can just share with us, why are you focusing on these 2 in particular? I thank you.
I should like to thank the distinguished representative of South Africa, and I now give the floor to the distinguished representative of the Education and Academia Major Group.
Okay. Is that for me? Thank you, Mr. President. We welcome VNR report by Eritrea. Eritrea's indefinite national service is one of the main reasons that Eritrean youth continue to flee the country. This has been described as slavery. Education, which is a fundamental human right, became militarized and in 2021, the Eritrean government closed down 17 schools, including Al-Dia. Gender-based violence is endemic in the military, and this has been documented in the COI report, and no qualitative steps have been taken to redress the situation in the Eritrean military. Women especially require inclusion in the economic, political, and social sphere. How does the Eritrean government plan on implementing economic inclusion in accordance with Sdg Iii while maintaining an economic monopoly through the Red Sea Corporation? In the last year, 27 Catholic-run health centers in Eritrea have been closed down. This has especially affected rural communities who do not have access to healthcare. The Eritrean government should be investing in the health of the nation, especially during the global pandemic. Eritrea is the only country in Africa that has not made COVID vaccinations available for its citizens. What step is the Eritrean government taking to ensure COVID-19 vaccinations are available to all Eritreans and working to improve the infrastructure of healthcare in the country? Furthermore, what was the rationale for closing hospitals and schools? The conflict in Tigray is also affecting the situation inside the country, as young people have been mobilized to fight in the war. This has been a loss to the agricultural sector and adds to food insecurity in the country. As 70% of Eritreans live in rural areas, it is important to include them in the economic program and provide affordable and clean energy. What is the Eritrean government?
I should like to thank the distinguished representative of the Education Academia Major Group, and I now offer the floor to the distinguished representative of the Dominican Republic.
Muchas gracias, señor.
Thank you very much, Mr. President. Your Excellency, Senora Sofia Sotomarian, the permanent representative and other distinguished representatives. I would like to congratulate Eritrea for their interesting VNR explaining their itinerary towards the SDGs and the 2030 agenda. My question is connected with the issue of lessons learned. What good practices have you taken away from this process that you would like to share with other member states? Thank you very much. I should like to thank the representative of the Dominican Republic, and I now give the floor to the distinguished representative of Senegal.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. President. I would firstly like to congratulate Her Excellency the Ambassador for her outstanding presentation of their first VNR on the implementation of the SDGs. I have a couple of questions I'd like to put. Firstly, how did you manage to mitigate the impact of COVID-19 on the progress achieved in implementing the SDGs? And then my second question, Eritrea is one of those countries on the track of the Great Green Wall. I'd like to know what measures have been taken by the Eritrean government regarding this initiative of the Great Green Wall. Thank you very much, Mr. President, and my congratulations again to the Eritrean delegation. I should like to thank the delegation from Senegal, and I now give the floor to the distinguished delegation from Turkey.
Thank you, Mr. Chairman. We would like to congratulate the delegation of Eritrea for successfully presenting the first VNR. Please allow me to ask the following question. What is the level of integration of SDGs into the national policies and their implementation in Eritrea? Thank you.
I should like to thank the distinguished representative of Turkey, and I now give the floor to the representative of Egypt.
Thank you, Mr. President. First of all, I would like to congratulate Eritrea on presenting their first VNR and for the achievements highlighted. Also, thank you for this comprehensive review of the report and for sharing the lessons learned and the insights. Can you please shed some light on the plans that the governments have on the national level to follow up on the VNR? Thank you.
I should like to thank the distinguished representative of Egypt, and I now give the floor to the distinguished representative of Pakistan.
Thank you, Mr. President. I would first like to congratulate Her Excellency for presentation of Eritrea's first VNR. I would like to ask that what modalities did your government adopt to ensure meaningful and inclusive participation of stakeholders in the process? Thank you.
Agradezco la distinguida.
I should like to thank the distinguished representative of Pakistan, and I now give the floor to the distinguished representative of India.
We congratulate Eritrea for presenting their first VNR, and considering that peace is an important component of sustainable development, we would like to pose a question to Eritrea. From your experience, what has been the impact of regional peace and security on SDG implementation? And what are some of the external challenges, according to you, that have had an impact on the implementation of the SDGs? Thank you.
I should like to thank the representative of India, and I now invite the permanent representative of Eritrea to answer the questions for 4 minutes, please. Thank you.
Thank you. Had I known you were going to ask me such difficult questions, but I'll put them in the order of importance. And on the issue of national service, I'm not sure why it's a big issue for a country as small as Eritrea with a small population to mobilize its entire population for its development efforts. And many countries do that, developed countries do that. And so the national service has been politicized for many years, and he has been brought up today also. And I think Eritrea has responded to the issue of national service and the Sawa military service that we have for our youth on multiple occasions, on multiple fora, at the Human Rights Council, and I think through the UPR process, and exhaustively, if I might add. And if there's anybody that wants more information, I welcome you to come to my mission so I can give you a more elaborate answer, so that we use up our time to concentrate on what brought us here today, the VNRs, and our very first VNRs. So what modalities did the government adopt? Well, the government used an whole of government, whole of society approach. And as I stated in the statement earlier, the national, it was based on mutual exchange, knowledge sharing, peer learning process. A national SDG task force and thematic working groups were established, which included all involved active participation and contribution of experts from within the country and from the different ministries, departments, CSOs, academia, and the UN system in the country. So this process had wide participation of government, entities, and other stakeholders, and in Eritrea's case, civil society, our National Union of Eritrean Women, National Youth Association, and many other CSOs within the country played a great role in the development plans and post-independence, and in the implementation of the national development plans today. And why did we focus on SDG 3 and SDG 13? As we said, the SDG on health during the Millennium Development Goals, that was one of the areas that we achieved the most. And it also gave us an idea to report on all the SDGs and present a comprehensive report, but learned that we need to limit the scope, so to organize ourselves best and build our capacity for the future. The SDG and 13 are also critical to the general public and amongst the top priority for the government, and as such, the government has made huge investments. Additionally, the existing data availability on the goals provided us an advantage to make detailed progress report. And the next time we do our VNR, we promise to have more data on the other SDGs, so that we can give you a more comprehensive presentation. What is the level of integration of SDGs? It's closely aligned with our national priorities. Eritrea did have a development program before the SDGs came along, so it was very easy to align the programs.
Could you take a minute for a consult about the interpretation, please? As it is known, after 6 p.m., if participants agree, we will continue with our interpretation. I release the interpreters and thank them for their work today. I think we are agree. Ambassador, you can continue, please.
With no interpretation.
We don't have interpretation.
Okay, I promise not to speak in Spanish. As I said, the SDGs were aligned with the priorities of the country because we did have a development program before the SDGs came to town. So it was only proper, and also since we were committed to the SDGs, to find a way to map and align the SDGs with the priorities in our country. But there are many areas that we could be working on to integrate more of the SDGs and more into our development plans, in the implementation especially, and the monitoring and evaluation also is important. What best practices have we drawn? We're learning. We're learning and we're listening and we're paying attention. And this is our first VNR report and has been an enormously enriching experience even for me. And it's in our best interest to endeavor to implement the SDGs from Eritrea's perspective, using the best practices, which was a high level of commitment from the leadership, a high level of commitment, participation, and contribution from the various stakeholders in the country. And the process was done with full national capacity through the utilization of local experts in all phases, including progress report and writing it. And this itself was an important exercise on maximizing our national efforts. How did we manage to mitigate the disruptive impacts of COVID? We didn't stop working. Agriculture went on, manufacturing kept on. They were all exempted from the restrictions under lockdowns, and the government and the private sector also committed to pay the salaries of all the workers in their employ, and the food and essential supplies were distributed to needy families. And I think somebody called it social capital. We have a good fount of social capital in Eritrea, of helping each other and helping our neighbors. On peace and security, when there's no peace, there's no security, and there's no development. And so yes, the issues in the Horn of Africa affect us, and most importantly, we were affected by the sanctions, the illegal sanctions that lasted for 9 years, from 2009 to 2018. The covert sanctions were more problematic and were challenging to the country from doing international financial transactions, trade of goods and services, even with our neighbors, public procurement, and even for projects financed by international donors. The transitional crisis experience in our neighboring countries also denied us the opportunity for using the goods and services that could have been easily gained and support the implementation of the SDGs. And of course, the intervention of external actors in the region complicated the geopolitical effects in the country and in our neighborhood. And hopefully now things are calming down. So, and if they remain this way and have acquired stable peace, we'll be able to do more of our development efforts and concentrate more on that. What do we plan to do with this VNR and this process? We want to tell the story to more and begin with our own people, with our own communities, and with our own diaspora, which is a strong part of our development partnership. And we want to be able to tell the story in many different ways. And maybe we don't have the quantitative data that you're looking for, but we may have qualitative data that we can share and tell the story in the way that it needs to be told, and show that maybe we're way ahead in this SDG game than we give ourselves credit for. I believe that's the last of the questions that I've written. And they'll remind me if yeah. I thank you.
I thank Her Excellency Sofia Tesfamarian, Permanent Representative of Eritrea to the United Nations, for her response. We have thus completed our program of work for this meeting. The forum will reconvene tomorrow at 9